Hi, my name is Jenna Beelman. I am a Cedar Crest College nursing student. Today I am presenting my evidence-based project research on uterotonic drugs and the correlation with postpartum hemorrhaging. My PICO question reads, in pregnant women in the third stage of labor, is misoprostol or oxytocin the most effective in nursing practice for preventing and controlling postpartum hemorrhaging? So some of the significance of postpartum hemorrhaging in this issue of finding the proper drug to control it and prevent it is that about 140,000, or that's really about 1 in every 4 labors, ends in maternal death due to postpartum hemorrhaging. Postpartum hemorrhaging is also on the rise. And it's really turning into this huge thing because of moms are developing a lot of comorbidities. So that's a huge deal. And the process of the literature that we used was to use CINAHL and as well as Google Scholar. By using these two, I was able to find a top 3 articles. When using CINAHL, I used the keywords oxytocin, postpartum hemorrhaging, misoprostol, and when I used those, I was able to narrow down the research to 163 articles that were all between the dates of 2011 to 2019. As well as in the English language and a United States published article. When I used Google Scholar, I typed in this sentence, postpartum hemorrhaging using oxytocin versus misoprostol, and was able to come up with roughly about 1,100 results that were between the years 2011 and 2019, also published in the United States and in the English language. My top 3 articles that I had used were by Condi Agudelo et al., Gibbons et al., and Ragmir et al. These articles did discuss the importance of figuring out the first-line agent for postpartum hemorrhaging. They did discuss how oxytocin should still be the first line just because misoprostol does have a lot of side effects associated with it, as well as there's just not enough research out there. It's not as effective as oxytocin either. But they did all come to the conclusion that more research needs to be done to figure out other solutions and treatment options for us, since misoprostol is so cheap versus oxytocin. They're trying to find out more cost-effective ways to better manage these patients. For recommendations of practice, they really recommend that using misoprostol as more of a secondary line of defense, as well as more for patients in less severe cases. And then just going off of that, we should be using their lab levels to go off of the effectiveness, which can be using their hemoglobins and getting pre and post hemoglobins for these patients to really see where they are as far as pre-delivery and post-delivery. They also talk about how we should be willing as nursing staff and as medical staff to discuss with our patients in less severe cases of postpartum hemorrhaging, utilizing misoprostol to see if it works in less severe cases of postpartum hemorrhaging. And just in conclusion, oxytocin is going to be our first line of defense agent, and we're going to need further research to really be able to determine where the future is taking us and how we can really narrow down and crack down the rising rate of postpartum hemorrhaging in these patients. And just dealing with the fact that comorbidities in the maternal patients is on the rise. which is leading to them having a more risk of developing postpartum hemorrhaging. And so we need to find a way to deal with that and really crack down on their prenatal care in order to better have better outcomes for after delivery.